Hi friends, welcome back to my channel. Today we are going to discuss about the evaluation part of the Osce assessment that it comes along assessment, planning, implementation and evaluation. Evaluation means that is the handover part. You have done the assessment, then you have done the plan for a care plan, then you did the medication administration, the implementation, what all things then after that you are going to hand over this patient. It may be after your due shift you are handovering to the next shift, or either you are transferring the patient to another department, or even you are referring this patient to a mental health nurse or social worker or dietitian, whoever it is, you are just endorsing this patient to them. So here we are using a specific tool that we called SBAR technique. That is, the acronym stands for situation, background, assessment and recommendation. So we will see in detail what comes under assessment criteria, background criteria and the assessment situation, background, assessment and recommendation. It's an 8-minute session. You can make the notes here, but it will not be marked, so it will help you a lot. Otherwise there is a chance to forget some points what the patient has told. And one more thing, they will provide all details from the assessment station, planning station and implementation station, so you can use all these information to give the handover to them. So we will start with the situation. So I will explain in detail how what all information we have to include in the situation. So first you have to introduce self and the clinical setting. You can tell I am a nurse who is working in the emergency department. Now I am going to hand over this patient because my duty is about to finish. Or you can tell because I was going to refer this patient to you, like that. Then states the patient name, hospital number and date of birth and location. So from which department we are going to, then what is the purpose of. Then states the reason for the handover, that as I mentioned, if your duty is about to finish or you are transferring to other department, you can just does like that. Then next comes the background. Here what we have to states the date of admission or visit, reason for initial admission, then if the patient is referred to any specialist team and what's the diagnosis, that we have to mention. Then notes the previous medical history and relevant medication or social history, everything, and especially the allergy and reaction we have to mention here. Then give details of the current events and details of the findings from assessment. Then we can tell during my initial assessment what all the findings I have seen. And now we can give the assessment states the most recent observations, any results from assessment undertaken and what changes have occurred. We can mention during my initial assessment at 10 o'clock. This was the vital signs like that, and now it's if there any deterioration, improvement like that, we can connect it and tell them. Then in the assessment station we have to identify the main nursing needs. That is also what we have written in the planning station. 2 care plan we have written. We identified 2 needs of the patient. That one we can, and what all care we provided like that we can mention them. Then state nursing and medical interventions completed. That is that if the patient is at risk of surgical wound site infection, means what we can tell, what all we advise the patient to avoid touching the area with the bare hands. Then provide personal and hand hygiene, like that all things whatever we have written we can inform them. Then still we can tell, although we provide all this care, but still I am concerned about this thing because she is at risk of developing infection, like that the needs we can tell again. Then next comes the recommendation. So here we can tell what is required of the person taking the handover and proposes a realistic plan of action. If you have to continue the current management, or if there is any antibiotic to complete any course of antibiotic, you can tell them like that. Then overall what they are looking here, the verbal communication is clear and appropriate, and systematic and structured approach taken to handover. That is the thing they are looking there. So if you plan well, you will get enough time. It's 8 minutes is enough and more to do the handover. I think it's clear for you. If you have still queries, please comment below the comment box. This is the easy station for you. So no need to worry about this station. Just needs some practice. That's enough. Thank you for watching my channel and keep supporting. Thank you. Thank you very much.